If you want to become a doctor in 10 minutes, this video is going to be the closest that you can get to it. I'm literally going to time 10 minutes on here and we'll give it our best shot to try to condense 10 years of medical experience, 5 years of medical school, 5 years of being a doctor into this one 10-minute slot. So let's go. Basically, when you go to medical school, you start off learning about anatomy, physiology, pharmacology, those sorts of things. Anatomy is just the study of the human body. The physiology is the study of how it works. Pharmacology is the study of medicines. And then you also learn about clinical history taking. So, you try to figure out what questions you should ask people to try to figure out what's wrong with their body. When we assess patients, there's a few components to it. So you start off with the history. Everything starts from a good history taking. You want to ask them questions that help you to find the diagnosis. Every diagnosis that you make has to rely on history to start off with. Like there's some exceptions to that. For example, like you might have a look at a rash and be like, oh, like that rash is definitely eczema, or this rash is, definitely skin cancer. But for general purposes, the history is always really, really important. So the questions that you might ask about pertain to each individual system. So, for each system in the body, we've got like cardiovascular, respiratory, hematological, gastrointestinal, neurological. You've got your dermatological things. You've got mental health type things. You've got just like every single system in the body, and you learn questions for each of those individual systems because they all have different medical conditions inside of them. Your history is aided by the examination. An examination is how you physically put your hands on the patient and work out things wrong with them. There are some pretty cool signs that you can elicit. So for example, if your eye is beating a funny way, that might indicate that you've got a stroke. It might also indicate that you've probably got something in your ear. There's a lot of signs that can mean a lot of different things. Some are pathognomonic. So for example, if you've got tennis elbow, what's going to happen is that when you push down on the hand like this, then it's going to hurt at the outside of the elbow there because there's a bit of inflammation and tendinopathy there. So we learn about how to examine patients and what physical signs correlate with which diseases. Some of them are actually just correlated with risk factors, and you have to go the next step forward. So for example, if you look at occasionally under people's eyes, they can get this thing called xanthelasma, and that's just a cholesterol deposit. If they've got a cholesterol deposit, they probably have got hypercholesterolemia, in other words, too much cholesterol in the blood. But then you have to make the next step of being okay, they've got high cholesterol in the blood. What does that mean? That could mean that it runs in the family, which is called familial hypercholesterolemia. It could mean that it is going to be a severe cardiovascular risk for them. So you have to think about their heart disease and how to check that. And the sort of list goes on. You've got a lot of sort of connections between one thing and another. So you've got your history, you've got your examination, and then you can do your investigations. So investigations include things like blood tests and chest x-rays or CT scans, MRI scans. You can look at different how electricity flows throughout the body. For example, in the brain, it's called an EEG. If you do it on the chest, it's called an ECG. So you can even look at the nerves. For example, in carpal tunnel syndrome, you can see that this nerve called the median nerve is affected there using a nerve conduction study. There's lots of different tests. During the coronavirus period, you've probably been tested yourself with a swab. These all help to narrow the differential diagnosis and come to diagnoses. When you've got when I say differential diagnosis, basically there's a lot of overlap between different medical conditions, and how they present. So for example, chest pain can be a lot of things. It can be a heart attack, it can be pneumothorax, it could just be physically your muscle. There's a lot of different things that it could be. And so as a doctor, we have to keep a very broad mindedness about the different things that could be happening to your body. And then you finally do management. Now, management is not just medications. Medication is obviously a big part of that, but management might be if you've got a certain type of toe infection, you just need to soak your toe in warm water for a while. Toenail infection. And it might be something else, you need to put your drops in, you might need to do some physiotherapy. For example, if you've got lower back pain, that is probably the most effective treatment for it. There's a lot of different modalities of treatment and management, and medical school is about figuring out what is the best way to actually help this person. So this is just the basics of medical school. This is probably what you do in the first year of medicine. In your sort of second and third years, you refine your clinical acumen, you learn about more medical conditions to do with everything, and you start to think about how everything ties together and how everything presents. When you get to your clinical years though, there's another extra step, which is that you've got your questions on history and examination, but people don't always report them in the same way, and you start to get a lot of variance of things. So for example, like the classic heart attack picture is when someone is clutching their chest and they say, oh man, I've got this dull central crushing chest pain, or they may just feel that. That's a very classic MI. However, you've got to think about the variance, because for example, women often receive an atypical version of that. They may just have a chest pain somewhere else, they may have a chest pain to the jaw or whatever. For whatever reason, atypical chest pain does tend to present, if it's an AMI, a bit differently in women than it does in men, for whatever reason. And you have a lot of variations like that in medicine. When you've got, for example, vertigo, people say like, oh, like I feel a bit dizzy, but they won't use the word vertigo to start off with. Vertigo means a very specific thing, for example. So your role is, like, as you become more and more experienced at being a clinician, you're actually trying to figure out, okay, like this symptom or the way that this person is saying stuff actually correlates with this particular symptom. And you start off by asking every question under the sun when you're like a medical student, because you're not really sure how to refine it. But as time goes on, your questions become much more refined, and you start to think in terms of diagnosis and be like, okay, I need to rule this diagnosis in, I need to rule this diagnosis out. What are the red flags for this condition that make me think, okay, this is really serious, and is there something that the patient is wanting to tell me but hasn't yet told me yet? That's sort of a bit of clinical medicine. You do a bit of procedural stuff. So in probably the first procedures that you'll do is things like doing a needle, injecting a needle into someone's arm or whatever, and you might even learn how to do an ECG or even do some basic dressings. Your skills amp up over time, so you start to learn things like how to suture wounds together, and eventually you learn how to make wounds and cut out skin cancers, that sort of thing, but that's sort of much further down the track and depends on which specialty you go to. You take this non-clinical medicine and this clinical medicine, then you go into actual working as a doctor, and even when you're working as a doctor, you're still learning on the job. And here you're starting to really learn the ins and outs of how the hospital system works, because you realize that actually it's not just about the medical knowledge that's the problem, but now you've got to figure out, okay, how do I work within this system, in this hospital system or in this medical system, to be able to enact the different treatments that I need to do. So for example, like, if I have an MRI for a patient, like how do I order that MRI? Because sometimes MRIs can be very, very expensive. In Australia, we have a bit of government funding that helps to, for certain criteria, you have to fill that, and then you figure out, okay, like this is what I would do for this patient, and I can order the MRI for this particular scheme or whatever, and they can get some money back. Now, something I haven't talked about, this is all like clinical academic stuff, and this is just purely diagnostics and management. But you really got to learn the art of talking to people as well, and the art of communicating with people, the art of dealing with an angry patient, of having to deliver bad news, of having to deal with quite tricky situations, how to prioritize, and all these sorts of things thrown in the mix of this already pretty complex mental model that you've got. Those things also take a lot of time. You can ask people that are smarter than you how to do that, but all of those people skills do develop over time if you really reflect on what you want to do. So we've talked about pretty much everything in terms of the mechanics of how to do stuff. I've got 1 minute left, so I'm gonna quickly run through some different medical conditions maybe. So like, for example, for the heart, you can have ischemia, which is where it doesn't have enough blood to it. You can have arrhythmias, where they pump a bit funny. You can have valvular diseases, or structural diseases like cardiomyopathies, where something's wrong with the actual physical structure of the heart. And sometimes the heart can get infected or inflamed, like pericarditis, for example. So those are the main sort of heart conditions. For respiratory stuff, you think about things like COPD, people might have interstitial lung disease, people might have asthma, people might have lung cancer. Those are sort of some of the main conditions to do with lungs. With regards to neurology, there can be literally anything, because neurology is so complex, but if you were to very broadly divide it, it's kind of like you have ischemia to different places, like a stroke. You can have different diseases of the mind, like Parkinson's, and yeah, I've got 10 seconds left, so I just want to wrap up by saying, I think the most important part of being a doctor is just making sure that you're actually helping people. And it sounds trite, but like that sometimes isn't obvious in terms of how to do that. All right. Oh, publish it. Let's go. I hope this has been fun. I just thought it'd be a funny idea. I'm sure there's a lot more to talk about in medicine. I'm sure that any doctor would look at this and be like, oh man, you didn't cover this. But like, come on man, I had 10 minutes. 10 minutes. How are you supposed to cover 10 years of medicine in 10 minutes? But yeah, hope this is fun. Catch you in the next one.